This is for video blog number 2. The first question was, what are the clinical data that can be used as diagnostic indicators for the identified disease? The disease I chose was gout. The clinical data that can be used as diagnostic indicators for gout would include joint fluid tests, which are gathered by providers. They usually draw patients' fluid from the affected joint area to study underneath the microscope to find out if they have urate crystals, which causes the flare-ups in gout. Also, like most providers in diagnostic exams, they usually draw a blood test to measure the level of uric acid in the blood, as well as creatinine in the blood. And they also do x-rays, ultrasounds, and CT scans to collect more clinical data. The second question, what are the clinical data that can be used as prognostic indicators for the identified disease? For gout, clinical data that can be used as prognostic indicators would be the observation of the uric acid lowering medication. They usually provide patients or prescribe patients with uric acid lowering medication. If a patient doesn't take care of their situation or take their medication like they're supposed to and treat it as it's directed, it can turn into tophi, which is hard nodule-like masses of uric acid in the affected area, which can cause more problems for that patient. That information can be gathered by continued testing throughout the treatment process of gout as the patient goes through and sees their physician regularly to find out if the symptoms worsen. The third question, what are the clinical data that can be used as clinical indicators for gout? Clinical indicators would be the testing and imaging diagnostics used to identify if the patient does actually have gout or not. That data allows doctors to gather information that they need in order to make sound clinical decisions on if that patient is actually suffering from the disease. Oftentimes, I think I've read that some patients kind of like self-diagnose themselves or kind of go to the point where they, like everyone else, we go on WebMD or wherever else and kind of self-diagnose before they actually go and pay their provider a visit to find out if it's gout that's that they're being affected by. So allowing the providers to gather the blood tests, the fluid tests, any x-rays or ultrasounds or CT scans if it gets to that point, as well as monitoring their medication for that uric acid lowering medication can kind of all be clinical indicators that will help diagnose gout.